the 7-month Medicare window that will cost you $100,000. One missed Medicare window adds a permanent surcharge to your premiums, paid every month for life. Most people confuse the 7-month clock with a 60-day rule, and that mix-up can quietly cost over $100,000 across retirement. I'll give you exact dates, documents, and steps to avoid the late enrollment penalty. Even people with good employer coverage get hit by this. There's one HR form they won't file for you that triggers the penalty. Stay with me for 8 minutes, and you'll walk away knowing the 3 clocks, what counts as creditable coverage, and the precise way to stay penalty-proof starting today, so you keep that $100,000 in your pocket, not in penalties. Map of the land, the 3 Medicare enrollment windows. Let's make the clocks simple. Medicare measures eligibility from 2 places: your 65th birthday and the end of active, creditable employer coverage after 65. Miss those, and the government's fallback clock starts, which is slower, more expensive, and can lock in penalties for life. Once you see how these windows line up, the rest becomes a checklist. Start with the initial enrollment period, your true 7-month window around 65. It opens 3 full calendar months before the month you turn 65, includes your birth month, and stays open for the 3 months after. Enroll during the first 3 months, and your coverage can start the first of your birth month. Wait until your birth month or later, and your start date can be delayed. The IEP is the default on-ramp for both Part A and Part B. Most people take Part A at 65 because it's premium-free if you or a spouse worked enough quarters, but Part B has a monthly premium, so the decision matters more. If you're not covered by active employer insurance, the IEP is when you should enroll in Part B and secure drug coverage, either a standalone Part D plan or a Medicare Advantage plan that includes drug coverage, so you avoid penalties and gaps. Now, the Special Enrollment Period is your safety valve if you're working past 65 and covered by active, creditable employer insurance through a current job, yours or your spouse's. Active means you're actively working for the employer sponsoring the plan, not retired or on COBRA. Creditable means the plan is at least as good as Medicare for the specific part we're talking about. For Part B, it's about employer group health coverage from a current job. For Part D, it's about prescription drug coverage that meets Medicare's standard. The SEP for Part B runs 8 months from the end of employment or the end of the employer group health coverage, whichever comes first. That's critical. Taking COBRA or retiree coverage does not extend the 8-month SEP for Part B. For Part D, the timing is tighter. You generally have 63 days after losing creditable drug coverage to enroll in Part D without a penalty. 2 different clocks, 2 different definitions of creditable, and 2 different deadlines. That's where people get tripped up. If you miss both the IEP and the SEP for Part B, you fall into the general enrollment period. The GEP runs January 1st through March 31st each year. Historically, enrolling during the GEP meant your coverage wouldn't start until July 1st, which created long gaps. Recent process updates allow coverage to start the month after you enroll during the GEP, but the penalty math still applies. You'll pay a late enrollment penalty for every full 12-month period you went without Part B when you should have had it. The GEP is your costly fallback. It gets you back in, but it doesn't erase the penalty. Here's the thing most people miss. Part B and Part D rules are not identical. Part B's SEP is 8 months and tied to active employment or the end of the employer plan from that active job. Part D's penalty clock measures uncovered months and uses a 63-day grace window after losing creditable drug coverage. You could be safe for Part B, but exposed on Part D if your employer plan's drug coverage is not creditable or if you miss the 63-day window after leaving work. That asymmetry is what causes the "I thought I was covered" moment. Let me tie this to how the government measures eligibility. Social Security handles Medicare enrollment, And they look for objective anchors: your 65th birthday month and documentation that proves you had active employer coverage after turning 65. Without proof, they assume you should have been on Medicare, and the penalty clock starts. For Part B, the proof is a specific employer verification form. For Part D, the proof is your annual creditable coverage notice and plan evidence of coverage. If you cannot show these, the system treats your gap as uncovered time, even if you had some other insurance, and the penalty gets assessed. Now, here's where most people mess up. They retire at 66 or 67, take COBRA because it feels safer, and think they'll add Part B later when COBRA ends. But the 8-month Part B SEP starts the day the employment ends, not when COBRA ends. If you wait until COBRA ends at month 18, you're 4 months late. You've missed the SEP, you're forced into the GP. If it's not currently open, you might face a coverage gap until the Part B start date, and you've locked in a penalty based on how many full years you were late. For Part D, if you don't enroll within 63 days of losing creditable drug coverage, the 1% per month penalty starts ticking and stays for life. Another common confusion is small employer coverage. If your employer has fewer than 20 employees, Medicare is primary at 65, and many small group plans are secondary. That means you're expected to enroll in Part A and Part B during your IEP at 65, even if you're still working. If you don't, you can end up with unpaid claims and a late enrollment penalty later. For larger employers with 20 or more employees, the employer plan can remain primary while you work, which is why the SEP exists. But you still need documentation to prove it when you finally enroll in Part B. Let's clarify creditable for drug coverage. Each fall, your plan must send a notice stating whether your prescription coverage is creditable for Medicare. Keep that letter. If the plan is not creditable and you're 65 or older without Part D, the penalty clock is running. If you're unsure, ask your benefits office in writing. The rule for Part D is unforgiving. 63 days after losing creditable drug coverage, the penalty starts accumulating. You don't want to guess here. Once you nail these clocks, everything else clicks. The practical takeaway is simple. Know your IEP dates, confirm if your current coverage is truly active and creditable, and if you work past 65, mark the end of employment on your calendar as the start of your Part B 8-month SEP. For Part D, mark a 63-day window if your drug coverage ends. Save every proof letter. In a second, I'll show you how those penalties actually hit your wallet and why they don't go away, and I'll give you the exact words to email HR, so you get the right documentation on time. The permanent penalty, how Part B late enrollment works. This is the penalty that stings the most because it's tied to a bill you pay every month for as long as you have Medicare. Why does it matter? Because Part B is the backbone of Medicare. It covers doctor visits, outpatient care, imaging, labs, therapies, and more. If you pay more for the exact same Part B for the rest of your life, that quietly drains cash you could have used for premiums, meds, or just living. And the penalty doesn't buy you extra benefits. It's the same coverage at a higher price, forever. Here's the rule in plain English. You owe a 10% surcharge on your Part B premium for every full 12-month period you went without Part B when you should have had it. Full 12 months matters. If your gap is 11 months, that's not a full year. If it's 12 months and 1 day, that's 1 full year. 2 full years, that's a 20% surcharge. 3 years, 30%. It stacks, and it sticks for life. When does should have had it apply? If you're 65 and not covered by active group health coverage from a current employer, yours or your spouse's, with at least 20 employees, Medicare expects you to enroll in Part B during your initial enrollment period. If you're working past 65 with true active primary employer coverage from a 20-plus employee group, you can defer Part B. But once active employment ends, an 8-month special enrollment period starts. If you don't enroll in Part B during that 8-month window, the government assumes you should have been in Part B, and your penalty clock starts. Now, how is the penalty calculated? Medicare looks at each full 12-month period you were eligible for Part B, but not enrolled outside of a protected period with active employer coverage. Multiply the number of full years by 10% and add that percentage to the standard Part B premium. The penalty is applied to your premium every month for life. The amount adjusts as the standard premium changes in the future, because the surcharge is a percentage of whatever the standard premium is that year. When does it start? The penalty starts the month your Part B coverage begins after a late enrollment. If you enroll during the general enrollment period, your coverage now starts the month after you enroll, but the penalty still applies based on the uncovered full years. If you enroll during a valid SEP, there's no penalty. That's why the 8-month SEP after employment ends is so critical. Miss it, and you've invited a permanent surcharge. Let me show you the math with a real-world scenario. Say you turn 65 in June 2024, stay on your large employer plan while actively working, and retire at 67 in June 2026. Your employer offers COBRA for 18 months, and you take it because it feels familiar. You assume you'll add Part B when COBRA ends in December 2027. The trap: your Part B SEP started the day active employment ended in June 2026 and lasts 8 months through February 2027. When you try to enroll in December 2027, you've missed the SEP by 10 months. You're pushed to the general enrollment period if it's open. You face a coverage gap until your Part B start date, and the penalty applies for the full 12 months you were uncovered after your SEP ended. That's a 10% lifetime surcharge. Now stretch it. If you didn't catch this until 2.5 years after employment ended, you've crossed 2 full 12-month periods. That's a 20% penalty for life. If the standard Part B premium is, say, $175 in a given year, a 20% penalty adds $35 a month, or $420 a year. Over 20 years, that alone is $8,400 in today's dollars, not counting premium increases. And penalties scale with the premium. So as premiums rise, your penalty dollars rise with them. If you're in a higher income bracket and subject to IRMA, you still pay the penalty on the base premium. Your total outlay is even higher because you're already paying more. Here's the part most people miss. COBRA and retiree coverage don't qualify you for the Part B SEP. They are not active employer coverage from current employment. You can keep COBRA for other reasons, but it won't protect you from the Part B penalty clock, and it won't make claims primary once Medicare should be primary. That means you can also get hit with denied claims because COBRA expects Medicare to pay first after 65. Another nuance: small employer rules. If your employer has fewer than 20 employees, Medicare is primary at 65. That means the plan likely pays secondary and expects you to have Part B. If you keep working at a small employer and skip Part B, you risk unpaid claims, and you don't have a protected SEP beyond your IEP because the employer plan isn't considered primary. Translation: at small employers, enroll in Part B at 65 unless you have a different protected path, which is rare. So how do you prove you had the right coverage and avoid the penalty? 2 forms matter for Part B. First, CMS 40B. This is your application to enroll in Part B. Second, CMS L564. This is the employer verification form that confirms you had active employer coverage tied to current employment after turning 65. Section B of the L564 must be completed by the employer. Social Security uses this to grant your SEP and waive any penalty. Here's the catch I teased earlier. HR won't file this for you. You must request it, follow up, and submit it with your CMS 40B to Social Security. If you submit CMS 40B without a properly completed CMS L564, the system assumes you didn't have protected coverage, and the penalty can be applied. Timing strategy matters. If you're leaving work, aim to have your CMS L564 completed before your last day, and submit both forms promptly, so your Part B starts the first of the month after employer coverage ends. That minimizes gaps and eliminates penalty risk. If you already left and time is tight, enroll during the 8-month SEP. Don't wait for COBRA to end. Every month you delay, after that 8-month window risks tipping you into a full 12-month period and adding another 10%. Common mistakes to avoid: assuming HR will manage Medicare paperwork, believing COBRA buys you time for Part B, thinking retiree coverage counts as active, misunderstanding small employer primary rules, and delaying enrollment because I don't go to the doctor much. The penalty doesn't care how often you go. It only cares whether you were enrolled when Medicare expects you to be. If you remember nothing else, remember this: your Part B price for life is set by what you do in a short window after 65, or when work ends. Get the dates right. Get the CMS L564 done. File it with CMS 40B during your SEP, and lock in the standard premium with no surcharge. Next, we'll tackle Part D's quieter trap, which adds a smaller monthly hit but the same lifetime sting, so you can shut both penalty doors before they quietly drain your budget. The silent budget leak. How Part D late enrollment works. Part D is sneaky because the penalty looks small each month, but it never ends, and it grows as the base premium changes. Why does this matter? Because drug spending tends to rise with age. If you add a permanent surcharge on top of that, you're paying more every single month for decades, for the exact same coverage others get at the standard price. The thing most people miss is that Part D uses a different clock and a different definition of creditable than Part B, so you can be fine on Part B and still get dinged on drugs. Here's the core rule in plain English. The Part D late enrollment penalty is 1% of the national base beneficiary premium for every month you went without creditable prescription drug coverage after your initial eligibility. Medicare recalculates that penalty every year because it's tied to the current national base premium, and they round it to the nearest 10 cents. It's not a one-time fee. It's a permanent add-on to your plan premium month after month for life, while you have Part D or a Medicare Advantage plan with drug coverage. Let me clarify creditable for Part D. Creditable drug coverage means your plan is expected to pay, on average, at least as much as standard Medicare prescription coverage. Employer and union plans can be creditable. TRICARE and VA coverage are generally creditable, and many retiree plans are too. Each fall, plans must send you a notice of creditable coverage. Save it. If your plan is not creditable, or you don't have drug coverage at all, and you're eligible for Medicare, and go more than 63 continuous days without creditable coverage, the penalty clock starts. That 63-day grace period is short, and it's separate from the Part B timeline. What counts as having Part D? Either you enroll in a standalone Part D plan, or you enroll in a Medicare Advantage plan that includes drug coverage, often labeled MAPD. If you pick a Medicare Advantage plan without drug coverage, and you don't have other creditable drug coverage, you're exposed. If you keep employer drug coverage that is creditable, you can defer Part D without penalty, but only while that coverage remains creditable and active. The moment it ends, your 63-day clock starts. Here's how the penalty math actually plays out. Suppose the national base beneficiary premium for a given year is $35. If you had a 15-month gap in creditable drug coverage, your penalty is 15% of $35, which is $5.25, rounded to the nearest 10 cents, so $5.30. That $5.30 gets added to your plan's monthly premium forever, and it resets as the base premium changes annually. If the base premium rises in future years, your penalty dollars rise too. Over 20 years, that small $5.30 grows with the base and stacks up to thousands of dollars you didn't need to pay. Where do people slip? The big one: I don't take meds. I get it. It feels wasteful to pay for drug coverage when your list is empty. But the penalty doesn't care about your current prescriptions. It only cares whether you had creditable coverage when you were eligible. If you skip Part D, and 2 years later your doctor prescribes something pricey, you'll have to enroll then, and you'll bring a 24% penalty with you for life. That's paying extra precisely when your medication needs spike. Another trap is assuming your employer plan's drug coverage is automatically creditable. Not always. Some high-deductible plans or narrow formulary plans may not meet Medicare's creditable standard. That's why the fall notice matters. If you didn't receive a notice, ask the plan in writing whether the drug coverage is creditable for Medicare and get the answer in writing. If it isn't, you need to enroll in Part D within 63 days to avoid the penalty. Now, let's walk a short scenario. You turn 65 in April, keep working at a large employer with creditable drug coverage, and defer Part D. You retire in August 2 years later. Your employer coverage ends August 31st. That triggers a 63-day Part D special enrollment window starting September 1st. If you enroll in a Part D or MAPD plan by early October with an effective date of October 1st, you avoid the penalty. If you wait until December 5th, you've crossed more than 63 days without creditable coverage. Your penalty starts ticking from November 3rd onward, and when you finally enroll, that gap translates into months of penalty you'll carry forever. What about COBRA and retiree coverage for drugs? Different from Part B rules, COBRA drug coverage can be creditable for Part D if the plan says so. The key is still the notice. If COBRA drug coverage is creditable, you can keep it and defer Part D without penalty while it lasts. But the minute that COBRA ends, your 63-day clock starts. If the COBRA drug coverage is not creditable, the clock starts on day one. Same with retiree plans. Many are creditable, some are not. Don't guess, verify, and keep the letter. Common mistakes I see all the time: choosing a Medicare Advantage plan without drug coverage because the premium is low, then realizing you lost your creditable status, moving to a new state mid-year, changing plans, and accidentally creating a short, uncovered gap, relying on a spouse's plan that quietly changed its pharmacy benefit manager and lost creditable status without you noticing. The fix is the same. Confirm creditable status every fall, store the notice, and if anything ends, start your 63-day countdown and enroll in Part D immediately. If you remember nothing else, remember this: Part D punishes uncovered months, not years, and the grace period is just 63 days. Lock in any MAPD or Part D plan before that clock runs out. Keep every creditable coverage notice. And don't wait until you need a prescription. The penalty doesn't care what's in your pill box, only what's on your calendar. A 5-minute enrollment today beats a lifetime surcharge tomorrow. The 7 costliest mistakes that trigger penalties. Now, here's where even careful planners get blindsided. I'll walk you through the 7 mistakes that most often lock in lifetime penalties, and exactly how to avoid each one. Mistake 1: working past 65 without truly active, creditable employer coverage. The thing most people miss is the word active. Medicare lets you defer Part B only if you or your spouse is actively working for the employer sponsoring the group plan, and the employer has at least 20 employees. If you're consulting per diem or technically on payroll but covered by an association plan, that may not count. If it's a small employer under 20 employees, Medicare is primary at 65, and the group plan often pays secondary. Why it hurts: you assume you're protected, skip Part B, and later face unpaid claims plus the late enrollment penalty. Fix: verify in writing that your coverage is from current employment and primary to Medicare, and that the employer meets the 20-plus rule. If not, Enroll in Part B during your IEP at 65. Mistake 2. Enrolling in COBRA or retiree coverage and thinking you're safe for Part B or Part D. For Part B, COBRA and retiree plans do not count as active employer coverage, so the 8-month SEP starts when employment ends, not when COBRA ends. Wait for COBRA to finish, and you can miss the SEP entirely, forcing you into the GP and a lifetime Part B penalty. For Part D, it's different. COBRA drug coverage can be creditable, but only if the plan says so in writing. Why it hurts? You pay for COBRA expecting it to keep the clock paused, but for Part B it doesn't. Fix: if you retire, enroll in Part B within 8 months regardless of COBRA. For drugs, confirm the COBRA creditable status, and if not creditable, get Part D within 63 days. Mistake 3. Relying on a spouse's plan that isn't large group active coverage. You can defer Part B if covered under a spouse's active large group plan. But active is the key again. If your spouse retired and is on retiree coverage, the Part B protection evaporates. If the employer has fewer than 20 employees, Medicare is primary for the spouse at 65 and for you as a dependent. Why it hurts? Couples assume we're on my spouse's insurance equals safety, but small group or retiree status breaks the rule. Fix: ask the spouse's HR for a written statement that coverage is from current employment. The employer size is 20 plus, and Medicare can be deferred without penalty. If not, enroll in Part B at 65. Mistake 4. Missing the 8-month Part B SEP after employment ends, even if COBRA continues. This is the classic timeline error. The SEP starts the month after active employment ends, or the month group coverage ends from that active job, whichever comes first. COBRA does not extend it. Why it hurts? Every month after the SEP risks tipping you into another full 12-month period and an extra 10% penalty. Fix: before your last day, get CMSL 564 signed by HR and file it with CMS 40B. So your Part B starts the first of the month after employer coverage ends. If you left already, file immediately. Don't wait for COBRA to run out. Mistake 5. Skipping Part D because I don't take meds. The penalty is based on uncovered months, not your current prescriptions. People often go a year or two with no drug plan, then need a medication and enroll, bringing a permanent 12% to 24% penalty with them. Why it hurts? You pay more for life precisely when your medication needs rise. Fix: if you're eligible and don't have creditable drug coverage, choose a low-premium Part D plan or a Medicare Advantage plan with drug coverage within your IEP or within 63 days of losing creditable coverage. Mistake 6. Misreading creditable coverage letters or never receiving them. Plans must send a notice of creditable coverage each fall. If the letter says not creditable, your 63-day clock is already ticking if you're Medicare eligible and don't have Part D. If you never received a letter that doesn't protect you, Medicare can still assess the penalty unless you produce proof of creditable coverage. Why it hurts? The penalty is assessed based on months without creditable coverage, and the burden of proof is on you. Fix: save and scan those notices annually, ask HR or the plan in writing if you didn't get one, and keep the response. If status changes mid-year, enroll in Part D within 63 days. Mistake 7. Moving states, delaying plan changes, and losing creditable status mid-year. Moves create special enrollment periods for Medicare Advantage and Part D, but they don't pause the Part D penalty clock if you go without creditable coverage more than 63 days. Some retiree or employer plans change pharmacy benefit managers mid-year, and creditable status can flip. Why it hurts? A short, unplanned gap becomes a permanent penalty. Fix: when you plan a move, line up a new Part D or MAPD plan effective the day your old coverage ends. If your plan announces a formulary or structure change, reconfirm creditable status in writing and be ready to switch within the 63-day window. Once you see these 7, you'll notice the pattern. People assume time is on their side, but Medicare runs on strict clocks and definitions. Let me give you quick micro-examples so you can spot them fast. A teacher retires in June, elects COBRA, and plans to start Part B the following January. They're already past 8 months by then. Result: forced into the GEP if needed and hit with a 10% penalty. The fix would have been filing CMS 40B and CMSL 564 in July for an August 1st Part B start. A healthy 66-year-old skips drug coverage. 2 years later, a new prescription becomes essential. They enroll in Part D during the annual enrollment period and bring a 24% penalty that gets recalculated every year. The fix would have been a $7 to $10 entry-level Part D plan from day one. A spouse on a small business plan with 12 employees continues working. The Medicare-eligible partner assumes the plan is primary. It's not. Medicare is primary at 65 for small groups. Claims get denied. And when they finally enroll, they owe a Part B penalty for full years uncovered. The fix: enroll in Part B at 65 with small employers. A retiree plan sends a notice, not creditable this year. It's October 15th. The member tosses it aside, assumes it's fine until December 7th. By mid-December, they've crossed 63 days and triggered a penalty. The fix: act immediately within that 63-day window, not just during the fall enrollment calendar. Before we continue, you need to understand one last nuance. Documentation is your shield. For Part B, the CMSL 564 completed by your or your spouse's employer proves active primary coverage past 65. For Part D, the annual notice of creditable coverage and evidence of coverage prove your protection. Without these, Medicare assumes the worst. With them, you secure your SEP and avoid penalties. If you remember nothing else from this section, remember this checklist. Confirm active primary coverage tied to current employment. Verify employer size. Treat the 8-month Part B SEP as non-negotiable. Treat the 63-day Part D window as a hard stop. Never rely on COBRA to pause Part B. Don't skip drug coverage because you're healthy, and file and save every proof letter. Once you nail these, everything else clicks. Your 7-step protection plan. Let's turn the rules into a clean, repeatable system you can follow under pressure. 7 steps. Keep them in order, and you'll stay penalty-proof. Step 1. Anchor your dates. You need 3 anchors on one page. Your birth month, the last day of active employment, and the date your employer coverage ends. Why this matters? All Medicare clocks hang off those anchors. Your initial enrollment period is the 7-month window around your birth month. Your Part B Special Enrollment Period starts when active employment ends, not when COBRA starts or ends. And your Part D 63-day grace period starts when Creditable Drug Coverage ends. Put these dates on a calendar you actually check, and set reminders 60 days prior to each. Step 2. Verify active and creditable in writing for both Part B and Part D. Don't accept verbal assurances. Email HR or your benefits administrator and ask 2 questions. Is my coverage tied to current active employment? And is the plan primary to Medicare for a 65-plus employee or dependent? That's the Part B test. Then ask, is our prescription drug coverage creditable for Medicare this year? That's the Part D test. For spousal coverage, ask the same questions about your spouse's status and the employer's size. Keep the written replies with your records. If the answer is unclear or they hedge, assume you need to enroll. Step 3. Get Section B of CMSL 564 completed correctly, and don't rely on HR timelines. CMSL 564 is the employer verification form that proves you had active group coverage after 65. Section B is the employer's part, and it must be filled out by someone authorized. The thing most people miss is small errors. Wrong dates, leaving the employment ended field blank, or checking the wrong coverage box. That can stall your enrollment or jeopardize your SEP. Send HR a pre-filled template with your name and social security number, your employment dates, and the exact last day of group coverage if it's different from your last day of work. Ask for a signed copy back within 5 business days and follow up until you have it in hand. Step 4. File CMS 40B and CMS L564 together to activate Part B during your SEP. CMS 40B is your Part B enrollment application. Pairing it with a properly completed CMS L564 signals to Social Security that you qualify for the SEP and should not be penalized. Submit them the month before you want coverage to start, aiming for an effective date on the first of the month after your employer coverage ends. If you already left work, submit immediately. Don't wait for COBRA to finish. You can upload documents through your Social Security account, fax them, or bring them to a local office. Keep confirmation of submission. Step 5. Secure Part D or an MAPD plan that includes drug coverage. Immediately. Don't wait until you need prescriptions. If you're staying on Original Medicare with a Medigap plan, add a standalone Part D plan within your IEP or within 63 days of losing creditable drug coverage. If you prefer Medicare Advantage, choose an MAPD plan so drug coverage is baked in. If you have other creditable drug coverage you're keeping, save the annual creditable coverage notice. If that coverage ends, enroll in Part D or MAPD before day 63 to stop the penalty clock. Step 6. Keep copies of all creditable coverage notices every year. In the fall, plans must tell you if their drug coverage is creditable. Create a MedicareProof folder, both paper and digital. Scan the creditable coverage letter, your CMS L564, your CMS 40B submission, and any confirmation numbers. If your plan changes pharmacy benefit managers mid-year, ask for a fresh written statement on creditable status and add it to the folder. If Medicare ever questions your history, you can produce proof fast and avoid penalties based on missing documentation. Step 7. Calendar future checkpoints. Open enrollment versus SEP versus GP. Each year, mark October 1st to review plan details, October 15th to December 7th for the Medicare open enrollment period, and January 1st to March 31st for the general enrollment period if you ever need that fallback. Also mark a 63-day alert anytime drug coverage might end. Retirement, COBRA ending, a move, or a plan termination. And set an 8-month alert the day your or your spouse's active employment ends to protect your Part B SEP. Treat those reminders like bill due dates, non-negotiable. Now, let me knit these steps into a simple workflow you can run in under an hour. Start by writing the 3 dates at the top of a single sheet. Birth month, last day worked, coverage end. Under that, write Part B, active and primary, and paste the HR email confirming yes or no. Then write Part D, creditable, and paste that answer. If either answer is no or unclear, circle Enroll Now. If you're leaving work in the next 60 days, print CMSL 564, pre-fill your info, send it to HR with a deadline, and schedule a pickup or secure email return. The day you get L564 back, complete CMS 40B and submit both together, choosing the earliest effective date that prevents a gap. Then enroll in Part D or MAPD the same week unless you have confirmed creditable drug coverage continuing. Finally, drop all proofs into your folder and set calendar reminders for the annual check, future you will thank present you, common friction points, and how to handle them quickly. HR delays? Escalate to the benefits manager and ask for a signed letter on company letterhead confirming active coverage dates, while L564 is processed. It can serve as interim proof if a local Social Security office needs to see something sooner. Unsure whether the employer meets the 20-employee rule? Ask for the average number of employees on payroll for the current and prior year. If they won't disclose, assume small and enroll in Part B at 65 to protect yourself. Mismatch between last day worked and coverage end? That's fine. Your Part B SEP starts when employment ends, but you can time Part B to begin the first of the month after group coverage ends, so you don't pay double. If you're on a spouse's plan, mirror the process. Your spouse requests and returns the L564. The employer certifies their active status. You file CMS 40B for your own Part B using that L564. For drug coverage, get the spouse's plan's creditable status in writing every fall. If your spouse retires mid-year, your 63-day drug clock starts the same day. Theirs does, even if COBRA is offered. Act together. The reason this framework works is it replaces guesswork with proof and deadlines. You're aligning your Part B and Part D decisions with the only two things Medicare cares about: dates and documentation. And once you build the folder and the calendar once, it becomes a 5-minute annual maintenance habit. If you remember nothing else from this plan, remember this: dates, documents, deadlines. Anchor your dates, get the right documents, and hit the deadlines. Do that, and you'll keep your premiums at the standard rate and never pay a penalty you don't owe. Share this checklist with a friend who's turning 65. Saving them from a lifetime surcharge takes one message: exact timelines, what to do before, during, after age 65. Here's the clean timeline that keeps you penalty-proof. We'll walk it from 9 months before 65 through late retirements, and what to do if you slip. Keep your calendar handy and write these dates down as we go. 6 to 9 months before 65, start your audit. Email HR or your benefits administrator and ask 2 things in writing. First, is your medical coverage tied to current, active employment and primary to Medicare for a 65 plus? Employee or dependent? That's your Part B deferral test. Second, is your prescription coverage creditable for Medicare this year? That's your Part D safety test. If you're on a spouse's plan, your spouse should email their HR for the same confirmations. If the employer has fewer than 20 employees, assume Medicare is primary at 65 and plan to enroll in Part A and Part B during your initial enrollment period. If the employer has 20 or more and confirms primary, you can consider deferring Part B, but only with written proof. While you're auditing, list 3 anchors on one sheet: your birth month, your last possible day of active employment if you plan to retire, and your group coverage end date if it won't match your last day worked. Add reminders 90, 60, and 30 days before each anchor. This prevents "I'll do it later" from becoming "I missed it." 3 months before 65, decide: enroll or defer. If you do not have active primary large group coverage from current employment, enroll in Part A and Part B within the first 3 months of your 7-month initial enrollment period. That helps your coverage start the first of your birth month. If you do have valid active primary large group coverage and you're staying at work, you can usually take Part A only and defer Part B. Just note the health savings account wrinkle. If you contribute to an HSA, don't enroll in Part A yet. Part A enrollment triggers a 6-month retroactive Part A effect that disqualifies HSA contributions for that retroactive period. In that case, stop HSA contributions at least 6 months before any Part A enrollment and plan carefully during your 7-month IEP. The 3 months before your birth month and 3 months after, lock in drug coverage. Even if you defer Part B, you must ensure you have creditable prescription coverage. If your employer drug plan is creditable, keep it and save the annual notice. If it's not creditable, choose a low-premium Part D plan or a Medicare Advantage plan with drug coverage during your IEP to avoid the penalty. Waiting because I don't take meds is how the Part D clock quietly starts. If you're planning to retire at or before 65, aim for clean handoffs. Target your Part B effective date for the first of the month after employer coverage ends. For example, if coverage ends June 30th, file in May for a July 1st Part B start. Pair a Medigap or Medicare Advantage decision with this timeline and pick a Part D or MAPD plan to be effective the same day. The goal is no gaps. Medical and drug coverage should start the day your employer plan stops. If you'll retire after 65, the day active employment ends is your Part B trigger. That starts your 8-month special enrollment period. The smart move is to get your CMSL 564 employer verification signed in your final week at work and submit CMS 40B with it. So Part B begins the first of the month after your group coverage ends. For instance, if your last day of work is March 10th, but your group coverage runs through March 31st, choose April 1st for your Part B start. That way you avoid double paying and avoid any uncovered gap. In the same week, enroll in Part D or an MAPD unless your drug coverage remains creditable under a retiree plan. If it does not, your 63-day Part D clock starts the day your employer drug coverage ends. The 63-day rule is the curveball that trips careful planners. You might think you have 2 months to sort drug coverage. It's 63 continuous days, and the penalty clock starts on day 64. If your employer coverage ends August 31st, count forward exactly 63 days. You need your Part D or MAPD effective on or before that 63rd day. Enroll early because most plans start on the 1st of the next month. If you apply on October 29th, you won't get a November 1st start with many plans. Apply in September and ask for October 1st if needed. Build in a cushion. If you miss your Part B SEP, you're pushed to the General Enrollment Period, January 1st through March 31st, with coverage starting the month after you enroll. Plan for the gap. Bridge coverage with COBRA if offered, but remember it doesn't erase the penalty and won't be primary once Medicare should be. Consider short-term coverage or a marketplace plan if you can't use COBRA. Book your GP enrollment the first week of January to minimize uncovered time. Then set a reminder to pick Part D immediately if you don't have creditable drug coverage during the gap. For people changing states, time your move with your coverage dates. You'll get a special enrollment period to switch Medicare Advantage or Part D plans, but that SEP doesn't forgive uncovered days. Line up a new MAPD or Part D effective the day your old drug coverage ends. Ask your new plan's broker or the plan directly to confirm effective dates in writing so you're not guessing. Now, let's knit these into quick scenarios. You're 64 and 9 months working at a 500-employee company. You email HR. They confirm active primary status and creditable drug coverage. You decide to defer Part B, take no Part A yet because you fund an HSA, and set reminders for your planned retirement next July. In May, you stop HSA contributions. In June, you submit CMSL 564 and CMS 40B for an August 1st Part B start, and you enroll in an MAPD for August 1st. No gaps, no penalties. Another case, you're 65 and 3 months at a 12-employee firm. HR confirms Medicare is primary. You enroll in Part A, and Part B now, pick a Medigap and choose a $10 Part D plan even though you take no drugs. You lock standard pricing for life and skip the penalty. One more, you retire at 67 on March 15th. Coverage runs through March 31st. On March 1st, you file CMS 40B with CMSL 564 and request April 1st Part B. You enroll in a Part D plan effective April 1st. Your 63-day clock never matters because you didn't leave a gap. The thing most people miss is start dates. Medicare and Part D typically start on the first of a month. Your employer plan often ends on the last day of a month. Use that rhythm. Always aim for first-of-month Medicare starts that align with last-of-month employer end dates. If you remember nothing else from this timeline, Remember this. At 6 to 9 months out, verify in writing. At 3 months out, decide and prep forms. At the handoff, match first of month Medicare starts to last of month employer ends. After retirement, treat 8 months for Part B and 63 days for Part D as hard stops. Dates, documents, deadlines. Hit them and you'll be penalty proof. Miss them, and the penalty meter never turns off. The $100,000 math, lifetime cost modeling. Let's put real numbers to this so you can see how a tiny monthly penalty turns into 6 figures across retirement. 2 forces drive the long-run total. The penalty is permanent, and it's a percentage tied to premiums that tend to rise over time. Add normal longevity, and if applicable, IRMA surcharges, and the lifetime cost snowballs. Start with Part B. The rule? 10% added to the standard Part B premium for every full 12 months late for life. To make the math concrete, use a simple model. Assume a base Part B premium of $175 this year. A 10% penalty adds $17.50 a month, or $210 a year. Now layer time. Over 25 years of Medicare, ages 65 to 90, that's $5,250 without even accounting for premium increases. If the standard premium grows modestly over time, your penalty grows in dollars right alongside it because it's a percentage. Now stretch to a common late pattern. Missing 2 full years after employment ends because of COBRA confusion. That's a 20% penalty. Using the same $175 base, that's $35 per month, or $420 per year initially. Over 25 years, that's $10,500 before inflation. If the average base premium climbs, say, 3% per year over time, your surcharge compounds in dollars. By year 10, if the base premium were around $235, your 20% penalty would be about $47 a month. By year 20, if the base were around $316, the same 20% costs you about $63 a month. Your total lifetime penalty dollars escalate with the premium curve. What if you were late 3 full years? That's a 30% surcharge. Start at $52.50 per month on the $175 base, $630 a year, and let that ride for 25 years while premiums trend up. You're easily into the tens of thousands of extra dollars just from Part B. And remember, this buys you 0 extra benefits. It's the same coverage at a permanently higher price. Now add Part D's, silent add-on. The Part D late enrollment penalty is 1% of the national base beneficiary premium for every uncovered month, permanent, recalculated annually, rounded to the nearest 10 cents. Keep the math simple. If the national base is $35 this year, and you had a 24-month gap because you delayed drugs when you retired, that's 24% of $35 or $8.40 per month after rounding. It looks tiny. Over 25 years, that's more than $2,500 before increases. But the national base changes, and your penalty resets on that new base each year. So the dollar amount grows over time. Where this gets serious is the combined effect. Take a very typical misstep. Late to Part B by 2 full years, 20%. And late to Part D by 18 months, 18%. On day 1, with our placeholder numbers, you're paying about $35 extra for Part B and roughly $6.30 extra for Part D. Call it $41.30 per month for $195 per year, rising over time. Over 25 years of Medicare. Even without modeling future increases precisely, you're well past $12,000 in today's dollars. With premium growth over decades, the lifetime burden is far higher. Now, layer IRMA if your income is above the thresholds. IRMA doesn't change the Part B penalty percentage. Your 20% is calculated on the standard premium, not the IRMA amount, but your overall monthly outlay is bigger, and the penalty is paid in addition to IRMA. If you're already paying, say, hundreds more per month because of IRMA, the penalty doesn't disappear. It just becomes part of an even larger bill for decades. That magnifies the financial pain right when cash flow matters most. Let's walk 3 modeled scenarios so you can compare. Scenario A, the 1-year slip. You retire at 66, misunderstand the SEP, and enroll late by 12 full months. Part B penalty equals 10%. Part D gap equals months because you grabbed a low premium plan within 63 days. Extra cost, $210 in year 1 for Part B, rising with premiums. Over 25 years, call it low 5 figures with premium growth. Not catastrophic, but still money you didn't need to spend. Scenario B, the COBRA trap. You retire at 67, keep 18 months of COBRA, miss the 8-month Part B SEP, and don't enroll until COBRA ends. You accrue 2 full years late, for Part B equals 20%. You also wait on drugs for 10 months after COBRA drug coverage ends, crossing 63 days, so Part D penalty equals 10%. Starting point, $35 extra for Part B and $3.50 extra for Part D per month. Over 25 years with rising bases, this easily climbs into the tens of thousands combined. Scenario C, the double whammy. You work at a small employer under 20 employees, assume the plan is primary, and delay both B and D for 3 full years. Part B penalty equals 30%. Part D gap equals 36% if the employer drug plan wasn't creditable. On day 1, you're paying roughly $52.50 more for Part B and about $12.60 more for Part D. That's $65.10 monthly, $781 annually to start, again, growing with base amounts. Across 25 to 30 years, this is where total penalties can cross the 6-figure mark when you factor premium growth, long coverage duration, and the reality that health costs often rise as we age. 2 more effects. Push the totals higher in real life. First, you rarely pay penalties in isolation. You pay them while also paying plan premiums, Medigap or MAPD premiums, and out-of-pocket drug costs that generally increase as your medication list grows. Second, a long retirement amplifies everything. Many of you will be on Medicare 20 to 30 years. A small monthly add-on that sticks for that entire horizon becomes a budget line that never leaves. Here's the shortcut nobody teaches. Your single best investment return at 65 is a penalty of 0%. That's not cute, it's math. Zeroing the penalty locks your baseline cost for decades. A 20% Part B surcharge and an 18% Part D surcharge feel minor on day 1, but they compound in dollars as the bases rise, and they're guaranteed to be charged every month for life. If you remember nothing else from this math, remember this: the penalty is permanent, percentage-based, and rides on premiums that tend to grow. Kill it at the source by hitting your SEP and 63-day window, and you keep that 6-figure leak out of your retirement budget. Employer plans, COBRA, retiree coverage, and HSAs. Before we dive in, remember the core principle we've used all along. Medicare cares about 2 things: dates and whether your coverage is tied to current employment. With that lens, let's cleanly separate active employer plans, COBRA, retiree coverage, small versus large group rules, and the HSA timing trap, so you don't mix categories that look similar but behave very differently for Medicare. Start with what counts as active employer coverage for Medicare Part B deferral. You or your spouse must be actively working for the employer sponsoring the plan, and the employer must generally have 20 or more employees. Active means on the job and on the payroll, not retired, not on severance, not on long-term COBRA. The plan must be primary to Medicare, for a 65-plus worker or dependent. If those conditions are met, you can usually defer Part B without penalty while you keep that coverage, and you'll have an 8-month special enrollment period when active employment ends. Now, here's where most people mess up. COBRA and retiree coverage feel like employer coverage, but they are not active coverage tied to current employment. For Part B, they do not stop the penalty clock and do not extend your 8-month SEP. If you retire in April and elect 18 months of COBRA, your Part B SEP still ends 8 months after your employment ends December. Enrolling in Part B after December risks a late penalty and may push you into the general enrollment period depending on timing. Keep COBRA if you want it for continuity, but treat Part B as if COBRA doesn't exist for SEP purposes. For Part D, the rules are different. COBRA or retiree drug coverage can be creditable, and often is, but only if the plan certifies that status. That means the Part D penalty protection comes from the creditable standard, not from active employment. If your COBRA drug coverage is creditable, you can defer Part D without penalty while it lasts. The day COBRA ends, your 63-day Part D window starts. If the COBRA drug coverage is not creditable, your 63-day clock starts immediately when you switch to COBRA. Same logic for retiree drug plans. Many are creditable, some aren't. Get the letter, keep it on file, and act before day 63 if creditable status ends. Let's separate large and small employer rules because your deferral strategy changes with employer size. At employers with 20 or more employees, the group plan is typically primary while you or your spouse actively works. That lets you defer Part B safely if you want, as long as you have documentation. At employers with fewer than 20 employees, Medicare is primary at 65. The small group plan expects Medicare to pay first and will often pay only as secondary. In that small employer scenario, you need Part A and Part B at 65 to avoid unpaid claims and penalties. There isn't a safe Part B deferral just because you're still working, because the plan isn't primary. If you're unsure about employer size, ask for written confirmation of average number of employees on payroll this year. And last, if they hedge, play it safe and enroll in Part B at 65. Spousal coverage adds a few edge cases. You can defer your Part B based on a spouse's active employer plan if your spouse is actively working at a large employer, 20 plus. The employer size rule applies to your spouse's employer, not yours. If your spouse retires, that coverage becomes retiree coverage, and your Part B protection ends alongside theirs. If your spouse works for a small employer, Medicare is primary for both of you at 65, so you each need Part B to avoid denied claims and later penalties. Multi-employer or union plans can be primary or secondary depending on the contract. Don't assume. Get a written statement on whether the plan is primary for a 65-plus participant and whether you can defer Part B without penalty. Now, HSAs, health savings accounts are fantastic while you're pre-Medicare, but there's a strict interaction with Medicare Part A. When you enroll in any part of Medicare, including Part A, you can't contribute to an HSA. Part A enrollment is retroactive up to 6 months, but not earlier than the first month you were eligible for Part A. That retroactive rule is the trap. If you enroll in Part A in June, Medicare can backdate Part A to January 1st, and HSA contributions you made from January through June become excess contributions subject to tax penalties. The clean fix is to stop HSA contributions at least 6 months before any Medicare enrollment date you plan and coordinate with your employer's payroll to turn off contributions in time. If you want to keep contributing to an HSA while you work past 65, you must delay Part A and Part B, which means your employer plan must be primary and you must understand the risk trade-offs. When you finally decide to enroll in Medicare, stop HSA contributions 6 months before your Part A effective date, then file. If you accidentally contributed during the retroactive window, ask your HSA custodian to remove excess contributions and related earnings before the tax deadline. Here's a quick workflow to keep these categories straight. 1. Identify your coverage type today: active large employer, active small employer, COBRA, or retiree. 2. If active large employer, confirm in writing that the plan is primary and that you can defer Part B. If active small employer, plan to enroll in Part B at 65. 3. For drugs, regardless of category, get the notice of creditable coverage each fall and save it. For if you retire, assume your Part B SEP starts the day employment ends and lasts 8 months. Ignore COBRA for that clock. 5. For Part D, if COBRA or retiree drug coverage is creditable, you can defer. When it ends, start the 63-day countdown and enroll in Part D or MAPD before day 63. Micro-stories make this real. A client retired from a Fortune 100 company, felt safe with an 18-month COBRA package, and delayed Part B until COBRA ended. They missed the 8-month SEP by 10 months, landed in the GP, and took a 10% Part B penalty for life. Another client stayed on a spouse's union plan that changed pharmacy benefit managers mid-year and slipped from creditable to not creditable. They didn't read the notice cross 63 days and now pay a permanent Part D penalty even though they enrolled the next annual enrollment period. The difference in both cases wasn't benefits quality, it was how Medicare labels the coverage. Common pitfalls to avoid quickly. Don't assume retiree coverage is primary. It rarely is after 65. Don't rely on verbal assurances from HR. Get written confirmation. Don't enroll in a Medicare Advantage plan without drug coverage unless you have other creditable drug coverage in writing. Don't forget the HSA 6-month retro rule. Set a calendar reminder to stop contributions. And don't time your Part B to COBRA end dates. Time it to the end of active employment and the first of the next month. If you remember nothing else from this section, remember the category cheat sheet. Active large employer equals safe to defer Part B with proof. Active small employer equals Medicare primary. Enroll in Part B at 65. COBRA and retiree coverage never extend the Part B SEP. For drugs, creditable beats category. If it's creditable, you're safe. If not, 63 days is your hard stop. And for HSAs, stop contributions 6 months before Part A to avoid tax pain. If you missed it, damage control and appeals. If you're already late or you think a penalty's been added, don't panic. Move fast and use the rules to your advantage. Your goal is simple. Establish a valid special enrollment period if one exists, cut uncovered time, and get errors removed. Start with Part B damage control. The fastest way to prove you qualify for a Part B SEP is to file CMS 40B and CMS L564 together. CMS 40B is your Part B enrollment request. CMS L564 is the employer verification that shows you had active group coverage tied to current employment after age 65. If you left your job within the last 8 months or your spouse did and you were covered under them, you can still use that SEP. Contact your former employer's benefits office and ask them to complete Section B with exact dates, when employment ended and when group coverage ended. If the dates differ, both matter. Submit both forms to Social Security immediately, online if possible, so your Part B can start the first of next month. The sooner it starts, the less uncovered time Medicare can count. If your 8-month SEP has already passed, your path is the general enrollment period. Enroll between January 1st and March 31st, and your Part B starts the month after you enroll. While you wait, line up stopgaps. If COBRA is available, it may help with some coverage, but remember it won't erase the Part B penalty and may pay secondary when Medicare is expected to be primary. Ask providers about cash pay, discounts, and charity programs for necessary care during the gap. If you use the marketplace, check eligibility rules carefully because marketplace plans also expect Medicare to be primary once you're eligible. Now, Part D damage control. Your priority is to end the uncovered drug gap. Enroll in a Part D plan or a Medicare Advantage plan with drug coverage as soon as you realize the mistake. If you lost creditable drug coverage and it's been fewer than 63 days, you can still avoid the penalty, submit right away, and pick the earliest effective date available, typically the first of the next month. If you're past 63 days, you'll likely see a penalty added when you enroll. Don't let that stop you from enrolling. The penalty only grows with more uncovered months. Next, documentation that can save you from a Part D penalty. Gather every notice of creditable coverage you've received from employer, union, or retiree plans. Pull plan evidence of coverage, ID cards, and any HR emails stating creditable status. If you had VA or TRICARE, those are generally creditable. Print proof of eligibility and coverage dates. If the plan failed to send you a creditable coverage notice in a year it was creditable, ask the plan for a retroactive letter on letterhead confirming creditable status and the exact period. You'll use these documents to challenge any month's Medicare marked as uncovered. If you were assessed a Part D penalty you believe is wrong, request reconsideration. After your plan sends you the penalty decision, they'll provide instructions to appeal through the independent contractor that handles Part D penalty reconsiderations. The clock is short, typically 60 days from the date on the notice. So submit quickly. Include copies of your creditable coverage notices, evidence of coverage, employer letters, and any COBRA or retiree documentation showing creditable status. Highlight the exact dates. If you had overlapping creditable coverage, call it out in bold on a cover sheet to make the timeline clear. What if HR is slow or unresponsive on your CMS? L564. Don't wait silently. Escalate to the benefits manager or HR director and set a written deadline. Ask for an interim letter on company letterhead confirming you were covered under a group health plan tied to current employment, your last day of active work, and the end date of group health coverage. Many Social Security offices will accept that letter temporarily while they wait for the formal L564. Keep calling, and if needed, ask a former supervisor to nudge HR. Speed matters because uncovered time can tip you into another full 12-month Part B penalty period. If you missed both the Part B SEP and you're outside the GP window, create a bridging plan. Put a reminder for January 2nd to enroll in Part B at the local office or online. In the meantime, keep every medical receipt. Ask providers for self-pay discounts and verify which services can be delayed safely. 4 high-cost meds. Apply for manufacturer assistance programs and state pharmaceutical assistance programs if your state offers them. Ask your doctor about generics or therapeutic alternatives until your Part D starts. Small but important timing fixes can shave months off penalties. If you're within the 8-month Part B SEP, elect the earliest possible Part B start date, even if that means a brief overlap with employer coverage at month end. For Part D, submit before the 15th to try to secure next month effective dates where allowed, and confirm the start date in writing with the plan. Get help if you're hitting walls. The State Health Insurance Assistance Program. SHIP offers free, unbiased counseling. They can help you interpret letters, prepare the CMS 40B and CMS L564 packet, and organize a Part D reconsideration file. Book a SHIP counselor through your state's aging office or SHIP website and bring your timeline notices and any denial letters. If your case involves employer-sized disputes or coordination of benefits denials, SHIP or a knowledgeable broker can help you script language for HR and Medicare to resolve primary versus secondary issues. 2 quick micro stories for confidence. One viewer retired, took COBRA, and got hit with a 10% Part B penalty. They still had payroll, records showing active work through the end of the month before retirement, and an old HR email referencing active coverage. They filed CMS 40B with a fresh L564 and requested a retroactive SEP enrollment dated to the month after group coverage ended. The penalty was removed, and Part B backdated to close the gap. Another viewer received a 24% Part D penalty. They found 2 years of creditable coverage notices from a union plan the system hadn't captured. They filed a reconsideration with copies of both notices and the plan's evidence of coverage booklet. The penalty dropped to 6%, reflecting only the true uncovered months. If you remember nothing else, remember this: act fast to stop the clock, document everything to rewrite the timeline, and escalate until you get the right forms filed. Dates and documents win appeals, and the sooner you move, the more months you save. If someone you know is stuck, send them this section and the ship link. Free help can erase costly mistakes. Annual habits to stay penalty-proof. Let's make this automatic so you never think about penalties again. 5 habits, once a year, plus a quick life event checklist. Do these, and you'll stay penalty-proof without stress. Habit 1. Save and scan your creditable coverage notices every fall. Each plan you have, employer, union, retiree, COBRA, or VA/TRICARE, should send a notice of creditable coverage for prescription drugs. Open it, read the line that says creditable or not creditable, and scan it into a Medicare-proof folder with the year in the file name. If it says not creditable, start your 63-day Part D clock right away. Don't wait until annual enrollment. Act within that 63-day window. Habit 2. Review plan changes during Medicare open enrollment, October 15th to December 7th. Pull your current plan's annual notice of change and compare premiums, networks, and drug formularies. If your meds changed or the plan dropped a pharmacy you use, switch to a better Part D or MAPD plan now. Confirm the new plan's effective date is January 1st and keep the confirmation email. If you're on employer or retiree drug coverage, you still review the notice and keep the creditable letter, but you don't have to switch unless creditable status changes. Habit 3. Calendar life events that trigger special enrollment periods. Add a recurring reminder to ask yourself each quarter: did I or my spouse change jobs, move, lose coverage, or see our plan terminate? If you retire or your spouse retires, that's the start of your 8-month Part B SEP and the start of your Part D 63-day window if drug coverage ends. If you move to a new service area, you get a Medicare Advantage/Part D SEP, but it does not pause the 63-day penalty clock for uncovered drug days. Tie every life event to a simple question: what date does coverage end? And what date does new coverage start? Habit 4. Reconfirm creditable status if your employer or retiree plan changes pharmacy benefit managers, deductibles, or structure mid-year. Send a short email. Please confirm whether our prescription drug coverage is creditable for Medicare for the remainder of this year. Save the reply. Plans can flip from creditable to not creditable outside of fall mailings. Your email trail is your protection. If status flips, your 63-day window starts on the flip date. So move fast. Habit 5. Revisit drug coverage even if you take 0 meds. Pick a low-premium Part D plan or enroll in an MAPD if you don't have other creditable coverage. The reason is simple. The penalty is based on uncovered months, not prescriptions. Paying a few dollars monthly is cheaper than carrying a permanent surcharge for decades. Now, the micro checklist to keep near your calendar. For Part B, active and primary, confirm in writing annually if you're still working at 65 plus. For Part D, creditable, confirm and file the notice annually. For HSAs, 6-month stop. If you plan to enroll in any part of Medicare, stop HSA contributions 6 months before your intended Part A date. For COBRA, treat as invisible for Part B. COBRA doesn't extend the 8-month SEP. For moves, align start and end dates. Ensure your new Part D, or MAPD, starts the same day your old drug coverage ends. 2 fast micro-stories to cement the habit. A viewer saved 5 years of creditable letters from a retiree plan. When Medicare assessed a Part D penalty by mistake, they uploaded the letters and the penalty vanished in reconsideration. Another viewer set quarterly reminders. When their spouse's employer merged and switched PBMs in March, they requested a fresh creditable status letter, learned it flipped to not creditable, and enrolled in Part D on April 1st, day 31, avoiding any penalty. Okay, so the tricky part is follow through. Build a single Medicare-proof folder, paper and cloud, and drop in creditable coverage notices by year, CMSL 564 copies, CMS 40B submissions, HR confirmation emails, plan confirmations with effective dates, and any appeal or reconsideration letters. Name files with dates first, so timelines are obvious. 20251015 creditable notice employer rx.pdf. When you need to prove anything, you're 2 clicks away. Finally, run a 10-minute annual audit each October. Confirm Part D creditable status. Act within 63 days, if not creditable. Review your plan's changes. Switch if your drugs or doctors are impacted. Verify active primary employer coverage if working at 65 plus. Update your L564 contact at HR. Set reminders for retirement dates, COBRA end dates, and HSA stop dates. Reprint your dates, documents, deadlines, checklist, and stick it on the fridge. Once you nail this rhythm, everything else clicks. You're not reacting. You're running a simple, repeatable system that keeps penalties at 0. Here's the takeaway: short Medicare windows. 8 months for Part B after work ends, and 63 days for Part D after creditable drug coverage ends. Set your premium price for life. Hit those dates, and you'll never pay a permanent surcharge. Do this next. Share this with anyone turning 64 to 67 so they don't miss their window. Subscribe so you catch the rest of the Medicare series, and watch the next video on avoiding IRMA surprises. It shows how income spikes raise Medicare costs and how to lower them before they hit. One share today could save someone you care about tens of thousands over retirement.